What is Chiricahua? A unique, rugged mountain range in southeastern Arizona and home to a band of Apache Native Americans in what is now the county of Cochise, named for the renowned Chiricahua Apache chief. Often hailed as the heart of the real Old West, Cochise County hosts the infamous town of Tombstone and is neighbored by New Mexico to the east and 100 miles of U.S.-Mexico borderlands to the south. It is here a binational culture has flourished for over a century. From mining to farming through legal trade and travel, people from both sides of the borderlands have lived and worked together in this unique community. But Chiricahua is more than a place or a people. It's a purpose. The Civil Rights Act of 1964 paved the way for federally qualified health centers, community-based providers of primary care services in underserved areas. In 1996, Cliff Wetton established the first medical clinic in Elfrida, Arizona to serve his farm workers and anyone in his community regardless of ability to pay, and Chiricahua Community Health Centers was established.
What Chiricahua is, it's a community health clinic that is the safety net clinic for Cochise County. So we see anyone who comes to our door regardless of their ability to pay. We see anyone.
We serve an area the size of Connecticut and Rhode Island combined.
Chiricahua's mission statement is caring for patients, building healthy communities. Because caring for patients, clearly that is the heart of what we do. The addition of building healthy communities brings in a much more complete, holistic picture to health.
Chiricahua is currently the only federally qualified health center in Cochise County. And just last year, we served over 35,000 patients, which is almost a third of the residents of Cochise County. And when we find that there's need, even in very small communities, we'll even serve on mobile medical clinics at times when we're not able to serve them in a brick and mortar building.
Chiricahua has one of the only mobile dental programs in the state. So we are able to get out into the nooks and crannies of our county.
It goes to Bisbee. It goes, I'm going to Pierce next month in Elfrida. It goes to Benson, Naco.
Our mobile units go to the high schools because they're one of the populations that doesn't like to go into the clinics, and our door is open for them to be able to come onto the mobile unit and get any kind of services that they might need.
Integrated behavioral health is very unique. Not a lot of clinics do that in this area. And so basically what we're doing is looking at the patient as a whole person and trying to come into the medical appointment and integrate services right then and there on the spot.
We have our hygienists embedded in the medical clinics. So when you bring your child in, they see the medical provider, they see the dental provider, the behavioral health provider, the dietitian, all within that same 30-minute visit.
You can get your flu shot, you can get your child up to date on their vaccines, measles to HPV vaccination for your teenagers. You can get nutritional counseling from the registered dietitians, which helps reinforce oral hygiene goals that we establish for every patient.
When people come into their dental appointment here at Chiricahua, they might not expect to see a dietitian, but here we try to treat the whole person, and that includes both their oral health as well as their nutritional health. So we like to combine the two in our integrated services.
The extra benefit that we have at Chiricahua is that we have pharmacies here as well.
And at Chiricahua, if somebody needs that medication, then they get it.
We go beyond those appointments. We want everybody to be healthy, to have access to healthcare. Also, health for all means educating. So community health workers go out to the farm fields, to San Simon, the Wilcox area, Winchester Heights, and they provide wellness services. So they check their blood pressure, their glucose. They keep a record of each farm field or site that they go to. So if they need to follow up again the following week or in the following months.
You have to believe to some degree in what we do. We're here to see everybody, and we're here to make less barriers to getting healthcare, not more.
We are all working hard to make sure that our patients and our community is taken care of.
And I think putting patients first is really what it means to be a Chiricahua employee.
I think of a Chiricahuan as somebody who loves this geography and occasionally is willing to drive an hour and a half to a meeting.
It makes me feel proud.
We, Chiricahuans, can provide patients with the best possible quality healthcare, mental health care, dental care, all of it. Chiricahua means health for all.
Chiricahua means health for all.
Chiricahua means health for all.
Chiricahua significa salud para todos.
Chiricahua significa salud para todos.
Chiricahua means health for all.
Chiricahua means health for all.
Chiricahua means health for all.
Chiricahua
is health
for all.
for all.